You have been invited for a transvaginal ultrasound scan to help in the diagnosis of your condition. Ultrasound uses high-frequency sound waves to obtain pictures of the inside of your body. It's popular because it doesn't expose you to any radiation, and it has been used without any side effects for over 30 years. During a transvaginal ultrasound scan, the ultrasound probe is placed inside the vagina to obtain clear images of the pelvic organs. We realise this is an intimate examination, and we will try to make you feel as comfortable as possible. Many patients worry that this will be similar to having a smear, but please be reassured that it is not as uncomfortable. The examination is not usually performed if you've not had an internal examination before or if you are a virgin, and it can be performed at any time during a woman's life, such as in pregnancy, during a period, or after the change of life or menopause. Sometimes we need to undertake a scan through your tummy before we do the internal scan. If this is the case, your appointment letter may ask you to have a full bladder. If so, please drink 1 or 2 pints of water 2 hours before your scan. Please do not worry if you cannot manage this. We can go ahead with the scan anyway. There are some other important things you need to address before you come for your scan. Your appointment letter will tell you where your scan will take place, and it's best to arrive in plenty of time. You may want to ask a partner, friend, or relative to come with you. It will be up to you if you want your companion to accompany you into the examination room itself, as this is an intimate examination. We suggest that you do not bring young children, as there are no facilities available to look after them. Please let us know before your appointment if you have any mobility problems for which you may require assistance, and let us know if you are allergic to latex. Even if you think your symptoms have resolved since the appointment was made, please still come along, as this will help you to better manage your condition, and we may see something that explains why you had the symptoms in the first place. However, if you decide not to attend, please let the department know in plenty of time so that your appointment can be offered to somebody else. When you are called into the examination room, you will be met by 1 or more of our specialist medical team. The room is quite dark so that it is easier to see the images of your body on the screen. If you are going to have a scan through your tummy first, you will need to lie on the couch and expose your front, so it is probably best if you wear trousers or a skirt rather than a dress. The specialist performing the scan will put clear gel on your skin. They will then use a probe to take pictures. The probe will be moved over your skin and images will appear on a screen. You may experience some pushing as the probe is positioned so that your internal organs can be seen more clearly. This should not be painful, but it may be a little uncomfortable. After the scan of your tummy, you will have the opportunity to go to the toilet. We will explain the transvaginal scan to you and confirm that you are happy for us to proceed. Please ask at any point during the procedure if you have any questions or if you have any concerns. You will then need to get undressed from the waist down and lie back on the couch. We will cover your lower half with paper or a blanket. Either a covered pad will be placed under your bottom or the couch will be repositioned to raise your pelvis. You will need to bend your knees and place your feet about a hip width apart. We use a small probe which is covered in a clear sheath and a gel. We have a very strict hygiene policy. The probe is cleaned before and after each patient and a new sheath is used each time. The sheaths are like condoms and most are made of latex. However, if you have an allergy to latex, we have non-latex sheaths available. The probe is inserted gently into your vagina. It will be moved around slowly and images will appear on the screen. This should not be painful, but it may be a little uncomfortable. Please let us know if you would like us to stop at any time. The scan will take up to 20 minutes. Once it is complete, you will be given some tissue to wipe away the gel and you can get dressed. We will not be able to give you a diagnosis at this point, but will pass on all the information to the requesting doctor, either your GP or hospital doctor, who will ask you to attend an appointment with them to discuss the results.